What is an endoscopy? Now, the good news is most of the time you're asleep when we do this procedure. You fast overnight, you come in the morning. The tube is about the size of your little finger, but quite a bit long because it's got to get all the way into the stomach. We lie you down. Anesthesia will give you something to make you a little bit sleepy. We numb up the throat sometimes, and we pass this tube it's a fiber optic tube that has a camera and a light. So as the tube is going down the mouth into the esophagus, into the stomach, and into the little intestine, and the tube is flexible. So we are looking at a TV and we are getting the images out of the stomach. And this is what an upper endoscopy takes, about 15 minutes. And through this same tube, it has little channels that we can pass tiny wires which have little biopsy instruments. So we call them forceps, but it takes essentially a pinch. And they also have loops. So we can remove anything suspicious. We can take a biopsy. Sometimes if it's small enough, we can remove it in its entirety. So many times that is how an upper endoscopy is done, to screen, but sadly, many times it is used to diagnose. So the biopsies are taken, they're sent to the pathology lab, they look at it under a microscope, and in about a week or two, your doctor will get back an answer. And this will say whether the cells have become cancerous, at risk of becoming cancerous, or not cancerous. And that will then make the decision about what happens next.